My name is Tim Pawlik, and I want to briefly discuss with you our paper that was recently published in JACS on the association of discharge against medical advice with surgical outcare and healthcare costs. Patients who leave the hospital prematurely are often in a compromised clinical state and may be at risk for suboptimal surgical outcomes. In this study, we sought to evaluate trends of risk and risk factors, as well as the impact on postoperative outcomes among patients who were discharged against medical advice. To do this, we use a national readmissions database to identify patients who underwent a surgical procedure between 2016 and 2020, and trends in discharge against medical advice, as well as costs, were analyzed using multivariable logistic regression in order to assess for predictors and outcomes, including length of stay, readmission, and expenditures. We analyzed over 1.7 million patients, among whom the incidence of discharge against medical advice was relatively low at 0.22%, which translated into about 4,000 patients leaving against medical advice. Interestingly, the rate of discharge against medical advice increased over the course of the study, and several factors were associated with an increased odds of being discharged against medical advice, including male sex, younger age, as well as substance abuse. Patients who were discharged against medical advice had longer hospital stays and higher index hospitalizations, and on multivariable analysis, discharge against medical advice was independently associated with readmission. And perhaps not surprisingly, patients who were readmitted after the indexed operation were more likely to leave a second time against medical advice on their second hospitalization. Overall, our data suggests that the incidence of discharge against medical advice is rising, and that these data highlight the need for targeted interventions, including risk stratification and behavioral support, to assist with discharge planning to prevent discharge against medical advice and the associated costs and medical risks associated with it.